if you are a parent who feels stressed out and burnt out, you are not alone. So much so that the Surgeon General, Dr. Vivek Murthy, is now sounding the alarm on this quickly growing mental health crisis.
48%, nearly half of parents, are saying on most days they are completely overwhelmed by their stress. This intensified culture of comparison that we're all living in, that's really potentiated and fed by social media and the online environment, where parents are looking around them and comparing themselves to sometimes hundreds of other parents, some of whom they know, some of whom they don't know, but they often come away feeling worse about themselves and like they're falling short as parents.
Joining us now is emergency physician and dean at the Yale School of Public Health, Dr. Megan Ranney. Doctor, good to see you. So, really upsetting to hear the Surgeon General there. I'm sure a lot of people can relate. What can parents do?
As a parent myself, honestly, I cheered this. I think it reflects the experience of so many parents across the country. To me, this advisory serves as a reminder to all of us as parents to put our own oxygen mask on first. And we spend a lot of time talking about the mental health crisis among kids. And I will say, as a parent and as an emergency physician, that I know that we can't help our kids get better if we're not better ourselves. So as a parent, try to find help, try to find time to take care of yourself, and advocate for policies in your community, at your workplace, in your state or city that help other parents, right? We need paid leave, especially during those early childbearing years. We need access to good childcare, not just in the toddler and infant years, but also throughout. Right? Nobody's workday ends when the school day ends. And we need to have communities that look out for each other. So to me, the advisory really illustrate all of that.
Yeah. And I wonder how damaging you would say stress is and how much of a toll that actually takes on the body. I think sometimes we sort of write it off as, it's just stress, it's just life, but it can also have a damaging effect physically on your health.
Absolutely. And I frequently tell my patients in the emergency department that the connection between the mind and the body is very, very real. When we are stressed, our body releases hormones, suppresses other hormones that can have an effect on our gut, on our immune function, and can actually have long-lasting effects on our vascular system, on risk of asthma, on risk of infections. So taking care of that stress not just helps your mental health, but also your short and long-term physical health.
And what about the connection between parental stress and how it might impact your children?
Absolutely. Kids need to see that their parents are okay. If you are stressed, if you are anxious, if you are depressed, your kids are going to see that and feel that. It makes them feel unstable, which is not to blame the parent for kids' mental health crisis, but rather to say, if you can take care of yourself, it will help your kid in the long term. Now, of course, again, we have to deal with some societal problems to help with our stress. Let's decrease the risk of gun violence in our schools. Let's provide safe places for our kids to play after school. Let's make sure kids are taken care of so that we don't have to struggle between work and parenting. But there are also things that you can do yourself, like working with your extended family or friends to help care for those kids to give you a little break.
Yeah. Doctor, I want to switch gears really quickly and get to something. It's Labor Day coming up. A lot of people are going to be outside. What do we need to know about this virus that's being spread by mosquitoes? It's apparently still rare, but we've already seen one man die from it.
Yeah, so this new virus, well, it's not new, but the one that's in the news right now, EEE or Eastern Equine Encephalitis, been around for a long time, luckily relatively rare. But when it does develop into this encephalitis or brain swelling, it's quite dangerous. About 30% of people who end up with encephalitis from the Eastern Equine Encephalitis virus end up dying. Now, there's two things to know. One is that it is borne by mosquitoes. So the best thing to do is to prevent mosquito bites. So try to stay indoors after dusk. Make sure you're wearing DEET or picaridin, some sort of a real, honestly, chemical bug spray, and try to not spend a lot of time around swamps or standing water where there are lots of mosquitoes. That's one thing. The other thing to know is that EEE is actually much less common than things like West Nile virus, which of course Dr. Fauci recently had. So I would say to protect yourself, not just because of the risk of EEE, but also because of the risk of all of these other mosquito-borne viruses that are out there. Getting bitten by a mosquito is never a good thing, especially not right now when we are seeing this surge in mosquito-borne illness.
Yeah, certainly worth a reminder. Dr. Megan Ranney, good to see you. Thank you.